Okay, so recording 2 is going to talk about maintenance of blood pressure. MAP must be maintained, this is the mean arterial pressure, must be constantly maintained around 95. Any deviation from this set point triggers mechanisms from the nervous, endocrine, and urinary systems that will act to restore blood pressure to this level. And the reason why we need to maintain MAP at 95 is so that we're getting appropriate perfusion to the tissues. Short-term control of blood pressure is primarily accomplished by the nervous system, and this contains hormones of the endocrine system, and generally is achieved by adjustments of resistance and cardiac output. So the nervous system maintenance of blood pressure, the main branch of the nervous system in control of homeostasis is going to be the autonomic nervous system and its 2 subdivisions. Both can actually have an immediate effect on blood pressure. If we look at the sympathetic axons, they release norepinephrine and epinephrine onto the cardiac muscle cells and smooth muscle cells of the blood vessels. Both increase blood pressure through 2 immediate changes. One, by increasing the heart rate and the contractility, which will increase the cardiac output. And by 2, vasoconstriction of all types of vessels, but especially the arterioles, increasing peripheral resistance. So again, when we look at sympathetic neurons increasing heart rates and increasing cardiac outputs and vasoconstriction, this will all result in an increase in blood pressure. However, on the parasympathetic system, via the vagus nerve, which is cranial nerve number 10, the release of acetylcholine primarily into certain cardiac pacemaker cells, particularly within the SA node and the AV nodes, and within the atrial cardiac muscle cells, will decrease blood pressure by slowing the heart rate and decreasing the overall cardiac output. This will mildly decrease contractility, decrease the cardiac output, and so the blood pressure. Most axons of the parasympathetic nervous system do not innervate smooth muscle cells of the blood vessels. However, increase in parasympathetic activity does allow vasodilation and a decrease in the peripheral resistance. This occurs because autonomic centers in the brainstem increase the firing of the parasympathetic neurons while inhibiting the firing of the sympathetic neurons. Therefore, when you inhibit sympathetic neurons, you will actually cause the vessels to dilate. So under vagus nerve stimulation, you're going to decrease your heart rate, which will decrease your cardiac output. And then you're also going to inhibit sympathetic stimulation, which will cause blood vessels to dilate. And this will give you the end result of decreasing your blood pressure. Again, these 2 things are going to be short-term, immediate responses, and they respond to baroreceptors. So with the baroreceptor reflex arc, you have the control center. This is referred to as the carotid sinus, and this is innervated by cranial nerve number 9, the glossopharyngeal nerve. Impulses travel via parasympathetic afferent neurons to the cardiovascular center within the medulla, where the impulses are integrated. Once that occurs, you'll end up with an effector response, which is a decrease in sympathetic activity causing vasodilation, and also stimulate vagoparasympathetic neurons to decrease the overall cardiac output. The homeostatic range and negative feedback will decrease both cardiac output and peripheral resistance. Blood pressure decreases to a normal range. The rate of firing of the baroreceptors therefore decreases. This decreases the output of the medullary parasympathetic neurons by negative feedback. The baroreceptor reflex may be initiated artificially to reduce dangerously high blood pressure, called carotid sinus massage. This can actually be performed by massaging the skid over both the carotid sinuses simultaneously, triggering the reflex and decreasing the blood pressure. Okay, so here you can see that, and here's the common carotid. You can see the glossopharyngeal nerve, cranial nerve 9 there. That's where you're going to find the receptor. The opposite feedback loop will occur if systemic blood pressure decreases. The receptors detect less stretch, and the rate of depolarization of the baroreceptors decreases. In response to a decrease in these receptors being activated, medullary parasympathetic neurons decrease output from the vagus nerve, and the medulla stimulates the sympathetic nervous system to increase cardiac output and peripheral resistance, therefore increasing blood pressure. And again, this is just looking at the opposite there. Valsalva's maneuver, this is used to test the baroreceptor reflexes. The subject bears down and tries to expire against a closed glottis, the airway in the larynx, as this occurs during coughing, sneezing, defecation, or heavy lifting. This raises the pressure in the thoracic cavity and reduces the venous return of blood to the heart. This causes a drop in blood pressure. It should trigger the baroreceptor reflex and generate an increase in the heart rate. Vasovagal syncope, this is a common scene in movies or TV, is when a person faints from shock or fear, called a vasovagal syncope. This is triggered by stimuli such as pain, extreme emotional stress, trauma, and fright. The exact mechanism that initiates vasovagal syncope is not known, although it seems to begin in the cerebral cortex and involves a complex series of neural events. This results in the brainstem autonomic centers tremendously increasing the parasympathetic output and virtually eliminating sympathetic output. The sudden autonomic imbalance has profound effects on the blood pressure. The vagus nerve directly decreases cardiac output by slowing the heart rate and mildly decreasing the strength of the heart contractions. Near cessation of the sympathetic output removes the sympathetic tone from the blood vessels, causing massive vasodilation and significant decrease in peripheral resistance. This, combined with a decrease in cardiac output and peripheral resistance, leads to a dramatic and sudden fall in blood pressure. Blood flow to the brain is then reduced, and a person may temporarily lose consciousness as a result. Usually when blood pressure falls, baroreceptor reflex initiates events to return blood pressure to normal. This appears complex neural event that will trigger the vasovagal syncope also inhibits the baroreceptor reflex. We can also see some chemoreceptor stimulations. Peripheral chemoreceptors primarily play a role in the regulation of breathing, also affect blood pressure and the receptors respond mainly to levels of oxygenation in the blood, but also to levels of CO2. The central chemoreceptors respond to a decrease in pH of the interstitial fluid in the brain. This triggers another feedback loop that indirectly increases the activity of the sympathetic neurons. This will result in vasoconstriction and a rise in blood pressure. The endocrine system can also work with the nervous system to maintain nearly all aspects of homeostasis, including blood pressure. Hormonal responses are much slower, as you guys have come to learn. The hormones that help to control cardiac output are epinephrine, norepinephrine, and thyroid hormone. Hormones that control resistance, this would be epinephrine, norepinephrine. These are released from the adrenal medulla and cause vasoconstriction, increasing peripheral resistance and elevating blood pressure. Angiotensin II is also a vasoconstrictor, and atrionatriuretic peptide causes mild decrease in peripheral resistance. However, long-term maintenance of blood pressure falls to the urinary system and certain hormones in the endocrine system that affect the kidneys. Control of blood pressure by increasing or decreasing the amount of body water lost at urine, which affects the overall blood volume. The endocrine system, which regulates blood volume through the release of ANP, angiotensin II, and ADH, as well as aldosterone. So when blood pressure increases, the atrial cells located in the heart will secrete ANP. This causes the kidneys to excrete more water and sodium ions. If you excrete more water and sodium ions, you will decrease the blood volume, therefore decrease the pressure. When blood pressure decreases, ADH secretion triggers thirst and increases the amount of water retained by the kidneys, which will raise the blood volume and the blood pressure. Renin, which is a hormone that is secreted from the kidneys, will trigger when blood pressure drops as well. This begins the process that activates angiotensin II. Angiotensin II will induce thirst, causing sodium ion retention. And as a result of retaining sodium, you'll also increase the volume of blood by retaining water. This triggers the secretion of aldosterone from the adrenal gland, which also causes the retention of sodium ions and water from the kidneys, increasing the blood volume. If blood pressure increases, more water flows through the tiny filtering tubes of the kidneys, the tubules. Then these cells can return to the blood. Water is then lost from the body as urine, and blood volume and blood pressure will decrease. If blood pressure decreases, less water flows through the kidney tubules, and these cells will have more time to reclaim the water and return it to blood. This results in a decreased urine production and a slight increase in volume and blood pressure. So looking at the overall maintenance of blood pressure, you have epinephrine, norepinephrine, angiotensin II, and renin. These are all going to increase peripheral resistance. Increase in sympathetic activity will also cause increased peripheral resistance. If you decrease renin secretion and increase parasympathetic activity, this will cause for a decrease in peripheral resistance. Now let's look at the heart. Thyroid hormone, epinephrine, and norepinephrine will all increase the rate and force of the contractions. Increased sympathetic activity on the neural side and decreased parasympathetic activity will also increase the rate and force of the contractions. Atrionatriuretic peptide and increased parasympathetic activity will have the opposite effect. If we look at blood volume, the third factor here, angiotensin II, ADH, and aldosterone will all increase blood volume. AMP will decrease blood volume. Disorders of blood pressure. Blood pressure must be maintained within a normal range. If blood pressure rises too high, which is referred to as hypertension, or falls too low, referred to as hypotension, severe disturbances in homeostasis may result. There are two types of hypertension: primary hypertension, where the cause is unknown, and secondary hypertension, where the cause can be determined. Hypotension is defined by a systolic pressure lower than 90 and a diastolic pressure lower than 60. And this is actually only diagnosed if the individual is actually symptomatic. Severe hypotension, or referred to as circulatory shock, can lead to loss of consciousness and organ failure. Blood pressure at that point is insufficient to deliver oxygen and nutrients to the cells, and this can be rapidly fatal. Most common cause of hypotension is reduced blood volume, referred to as hypovolemia, which could occur as a result of blood loss, fluid loss from diarrhea, vomiting, or overuse of diuretics, or insufficient fluid intake. Severe blood loss can lead to hypovolemic shock, and this can be fatal unless the blood volume is restored. Decrease in heart rate can also result in hypotension, generally due to medications prescribed to treat hypertension. Decrease in stroke volume is most commonly caused by heart failure, the inability of the heart to function efficiently as a pump. Severe heart failure can produce dramatic drops in cardiac output, and this may result in a condition referred to as cardiogenic shock. Excessive vasodilation can also produce profound hypotension. Many conditions can cause excessive vasodilation, including medications for hypertension, abnormalities in the autonomic nervous system function, and a decrease in blood pH. Another potential cause of excessive vasodilation is the release of chemical histamine into the blood during severe allergic reactions or anaphylactic shock. Excessive vasodilation occurs with certain bacterial infections, and this is seen with sepsis or septic shock. And that is the end of recording 2, which is the regulation of blood pressure.